Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. With careful consideration of the science, trends, data, and resource availability, the Dare County Control Group has asked staff to prepare a plan to address the lifting of restrictions on entry to Dare County while ensuring the safety of our community. The first phase will allow entry of non-resident property owners. Dare County's plan will be released on Tuesday, April 21st, 2020. In North Carolina, there are currently 6,794 cases of COVID-19 in 93 counties. There have been 179 fatalities in North Carolina associated with COVID-19. Currently, the state is reporting 373 hospitalizations across the state from COVID-19 illness. Dare County remains at 15 positive test results for COVID-19. Of the 15 individuals who have tested positive, 14 have recovered or are asymptomatically cleared, meaning they are 7 days post-testing with no symptoms, and 1 died. Dare County healthcare providers are testing individuals who they believe are in need of COVID-19 testing and meet the North Carolina Department of Health and Human Services guidelines for testing, which include fever of 100.4 or higher, cough, and respiratory illness. The return time for test results has dramatically improved since testing started in late February. We now are receiving results back within 24 to 72 hours. While the test results we have been receiving over the past week have all been negative, this does not mean that the COVID-19 virus is not in our community. Remember, the CDC reports that approximately 25% of patients with COVID-19 do not show symptoms. We all must continue to do our part to keep our community healthy. While North Carolina DHHS testing guidelines are to ensure those who are ill get tested, the guidelines currently do not provide for widespread testing. Public health leaders recognize the importance of being able to offer more widespread testing. The state has created an NCDHHS Testing Surge Workgroup. The Testing Surge Workgroup is charged with developing a plan to increase testing, expand testing sites and options, and address testing supply challenges, including the availability of personal protective equipment. The work group is composed of internal North Carolina DHHS staff and leaders from the public and private sectors. In addition to testing, a vital tool used in public health to assess the spread of communicable diseases like COVID-19 is syndrome surveillance. Syndromic surveillance refers to methods relying on detection of individual and population health indicators that are discernible before confirmed diagnoses are made. The fundamental objective of syndromic surveillance is to identify illness clusters early, before diagnoses are confirmed and reported to public health agencies, and to mobilize a rapid response, thereby reducing morbidity and mortality. Syndromic surveillance gathers information about patients' symptoms, cough, fever, shortness of breath, during the early phases of illness, even before tests are administered or results are received. We are fortunate in Dare County to have a strong public health epidemiology team who works closely with our area healthcare providers. We are in frequent communication with our healthcare providers, often multiple times in any given day. We share information on real-time numbers of patient encounters, descriptions of symptoms, potential linkages to patient encounters, and then we use that data in preparedness planning and actions to mitigate disease spread. As community members, we must continue to use the tools we have available to reduce the spread of COVID-19. These tools are social distancing, limiting direct contact other than members in your immediate household, practicing good hygiene, and using cloth face coverings in public settings where other social distancing measures are difficult to maintain, for example, in grocery stores or pharmacies. Please remember, social distancing does not mean social isolation. Social distancing is really physical distancing, so we limit the potential for the spread of the virus. Please continue to hang in there. If you need help, please reach out. We are fortunate to have many resources available in Dare County. A complete list of resources ranging from food needs to financial support to mental health help is available on the Dare County website at www.darenc.com/COVID-resources. As we move forward through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center at 252-475-5008. Thank you.